Hello everyone, welcome back to a new video on preclinical pharmacology. So, in this video, we will gonna discuss the drugs that are used in the helminthiasis. So, what are helminths? It is the general term which means worms. Worms are the invertebrates which cause a wide variety of diseases which are characterized as flat, elongated, and round bodies. There are various types of helminths, and some of them are mentioned here, such as tapeworms, roundworms, filariasis causing agents, and whipworms. So, based on that, we can say that anthelmintics are a group of antiparasitic drugs that expels parasitic worms and other internal parasites from the body by either stunning or killing them inside. Now, various types of helminths are categorized as roundworms, tapeworms, whipworms, and filariasis causing agents. We can easily determine the difference in their structure. Now, the very first is the roundworms, which is also called as nematodes. So it is characterized as long, round-bodied, and segmented worms, which having tapering at both ends. It basically involves a body cavity which is round in shape, having a one-way gut, that is one is present at the mouth portion and the other one is at the anal portion. Having chemosensory and mechanosensory neurons, which is connected over the cuticle. Cuticle basically helps them to connect with the host and also protects them from the external environment. Its body wall composed of a muscular longitudinal cell, and they primarily found in the intestine and fed on host blood and tissues. Next is cystores, also called as tapeworms. So they are ribbon-shaped parasitic worms having intestinal parasitic invasion at the larval stage. They contain head, also called as collex, neck, and the segmented body. Mainly they live in human gastrointestinal tract. Head portion consists of various hooks or grooves or suckers that helps them to bind with the intestine of the host. Now, it is the general classification of anthelmintic drugs. Mainly, the classification is based on the worm on which the drugs shows their action. So, mainly, there are four types of worm diseases. First is roundworm disease, which involves the agents such as Mebendazole, Albendazole, and piperazine. Second is tapeworm diseases, which involves the agents such as Praziquantel and Niclosamide. Third is the filariasis causing agents diseases involving drugs such as Ivermectin and Albendazole itself. Fourth one is the whipworm diseases involving various agents such as Albendazole and Mebendazole. First, now Mebendazole. It is the broad spectrum antibiotic which is introduced in 1972. So main mechanism of action of mebendazole is that it inhibits the microtubule synthesis. Microtubule synthesis is basically the synthesis involving two main proteins, that is alpha tubulin and beta tubulin. So the inhibition of the polymerization of these both proteins leading to the structural deformation because the drug binds with the beta tubulin portion of the microtubule synthesis, which leads to the structural deformity of the worm. Also, the other mechanism it uses is that, which is the alternate mechanism, it restricts the uptake of glucose, which leads to the depletion of glycogen storage, which ultimately leads to decrease in the ATP production. And finally, death of the worm or helminth. Now, some specific adverse effects of mebendazole involves loss of appetite, flatulence, tinnitus, and elevated liver enzymes. So tinnitus is nothing but the hearing sensational loss, which involves the blowing, roaring type of sound in the ear or the buzzing type of sound in the ear. Some of the marketed formulation of mebendazole involves Vermox, Mworm, Mebimol, Mebiv, and Mebex. Now, the next drug from the same category is albendazole. The mechanism of action of albendazole is quite similar with the mebendazole, as it also involves the degenerative alteration in the intestinal cell, as it also binds to colchicine sensitive site of beta tubulin as that of mebendazole, and inhibits the polymerization assembly of microtubule, that is the alpha and beta tubule. Some specific adverse effects of albendazole involves pain in abdomen, headache, temporary hair loss, and nausea. Some marketed formulation of albendazole, as we show here, involves Zentel, Sidazole, Wormnil, AlbenG, Alworm, Alobenza, Wormviv, and X1, out of which the Wormviv and Alobenza are quite majorly used. Now, the third drug is the Pyrantel PAM. The main mechanism of action of Pyrantel PAMate, as it inhibits the cholinesterase enzyme and increase the ACH concentration, which ultimately leads to the depolarization. Means what? So basically, it activates the nicotinic cholinergic receptor in worms, which causes the persistent depolarization of neuromuscular blocking agent, due to which inhibition of cholinesterase enzyme occurs, leads to contraction and spastic paralysis of worm, and the loss of intestinal muscular grip, which eliminates the worm in the stool of the patient or human. Some specific adverse effects of parental pamphlet involves irritability, dizziness, drowsiness, skin rashes, and the sleep disturbances patterns which are rarely seen. Some of the marketed formulation of parental pamphlet involves Pinex, Pinrit, Pyrentrin, Combentrin, Helmex, Helmintox, and Strongit, out of which Pyrentrin and Combentrin are quite much used than others. Then the next drug is the ivermectin. So main mechanism of ivermectin is that it binds to glutamate activated chloride channel, which leads to the influx of the chloride ion, causing the hyperpolarization. As a result, the parasites are leading to paralysis and finally the death occurs. So what happens here is the neurotransmitter GABA basically disturb the GABA mediated central nervous system of the worm and the neurosynaptic transmission. Due to influx of chloride channel, the hyperpolarization of the worm occur, leads to paralysis of the worm and finally the death. Now, some specific adverse effects of ivermectin involves neck pain, back pain, chest pain, fasten heartbeats, confusion, and sometimes seizures also occurs. Then marketed formulations of ivermectin involves Iverwell, Ivertic, Iverheal, and Ivernorm. Now, ivermectin is the most widely used anthelmintic drug among all the drugs, along with the albendazole and mebendazole. The next drug is praziquantel. So, main mechanism of action of praziquantel is quite similar to that of ivermectin, as it also disturbs the calcium ion homeostasis and antagonizes the voltage gated calcium channel, due to which the influx of calcium increases, uncontrolled influx of calcium occurs, which leads to muscle contraction and finally the paralysis, which leads to death of the worm inside the host cell. Now, some specific adverse effects of praziquantel involves rashes, diarrhea, fever, and vomiting. Some marketed formulation of praziquantel, such as Prazisure, Praziom, Prazi.F. So the next drug is Niclosamide. So the main mechanism of action of Niclosamide is quite similar to Praziquantel, as it is also the anthelmintic drug against the tapeworm. So it kills the tapeworm on contact with the tapeworm. Adult forms are mainly killed, not at the OA stage. So it is rapidly killed due to the uncoupling of oxidative phosphorylation, which leads to the stimulation of ATPase activity. Means what? So mainly there are two types of actions of nicotinamide. First is pH dependent and other is pH independent. The pH independent action involves the inhibition of mitochondrial oxidative phosphorylation, which leads to decrease in the ATPase production, which leads to decrease in the energy production in the worm. Ultimately, the death of the worm occurs. Then, next, the final adverse effects of niclosamide, which are the very specific name, that is itchiness, constipation, gastrointestinal disturbances, and anorexia. Some marketed formulations of niclosamide involves Niclosic, Niclon, Niclolif, and Niclobest. Thank you. If you like this video, then hit the like button, share the video, and subscribe the channel for more such informational videos.